tackling diabetes. Which is more important, effort or money? What I mean is this: when it comes to tackling diabetes optimally, do you think it is more important to put in the effort to holistically improve your lifestyle and dietary habits? Or do you think it is more important to have the money to spend to buy the best that money can buy in terms of medical care, or to buy supplements or superfoods that are purported to be good for diabetes in some way? If you only have one choice, if you were to choose one and only one of these two, effort or money, which would you choose? Which do you think is more important? Which do you think is more powerful? For me, I would say it is undoubtedly effort. The necessary effort, the elbow grease, the hard work to make the necessary and critical changes and improvements to your lifestyle and dietary habits as best as you could. You may have all the money in the world to buy yourself the best medical care, see the top diabetes specialists, get the most advanced digital health apps, or buy expensive supplements or superfoods to help you combat diabetes. But all that is not going to be an adequate substitute for an healthier lifestyle and diet that is critical in controlling and combating diabetes. From my experience training and coaching people, including my patients with diabetes, most people are more willing to spend money on expensive drugs, expensive superfoods or supplements than they are willing to invest the time and money in attending lifestyle medicine or food as medicine workshops or coaching programs. Because you know why? Because with drugs or even supplements, they think that they only need to pop the pills regularly without having to do anything, put in any effort, doing anything else. Whereas after attending lifestyle medicine or food as medicine training workshops or programs, and after learning what they need to do, they would still need to put in the effort, the hard work to make the necessary changes to their lifestyle and diet. Don't get me wrong. I'm not saying having the money, the financial resources to spend on combating diabetes is not helpful. It is always going to be helpful or even necessary. And many people do struggle to find even enough money to pay for the basic necessary medical care for the diabetes. And also, of course, diabetes can potentially be a very expensive affair, especially in the later, more serious and advanced stages of the disease, when the many serious complications of diabetes start to creep in, such as eye, kidney, heart complications, which are all potentially very serious, debilitating, and also very costly to manage. So, some amount of money is definitely needed and necessary directly or indirectly when it comes to managing diabetes. But what I am emphasizing is that you cannot expect that money alone is going to be the solution, because you cannot depend on medications alone to fully or adequately control and combat your diabetes. And neither can you expect to depend on superfoods, herbs, or supplements, regardless of how expensive they are, to help you optimally control diabetes. Because regardless of whether you have the money to buy the best that money can buy for diabetes care, you can never run away from the need to put in the effort, to invest in the hard work to holistically change and improve all aspects of your lifestyle and diet. Whether it is your sleep habits, your exercise habits, your stress management habits, and many aspects of your dietary habits. Many things that are critical and powerful in fighting diabetes do not require money. And even if you have the money, money cannot buy. For example, making the effort to exercise regularly, going for daily walks, making the effort to prioritize good sleep and to manage stress, as well as making the effort to improve your diet, such as reducing your intake of added sugar or high GI starchy foods, highly processed foods. All these are not just critical and powerful in combating diabetes. They all require effort more than they require money. Lifestyle is medicine. Exercise is medicine. Food is medicine, especially when it comes to combating diabetes. And there are many things we can do to improve our lifestyle and dietary habits that do not require money and yet are powerful in controlling diabetes, in retarding the progression of diabetes, in preventing and reducing the many complications of diabetes. If you have diabetes, do not make the mistake of thinking that money alone is enough to help you successfully combat diabetes. Regardless of whether you have a lot of money or very little money, you are still going to be able to have a good chance of adequately controlling and combating diabetes, minimizing the potentially adverse consequences of diabetes on your life. That is provided if you make the effort to do everything that you can, everything that you are willing and able to improve all aspects of your lifestyle and diet. When it comes to tackling diabetes, the most and powerful medicine comes in the form of our lifestyle. Exercise is medicine. Food is medicine. In case you are new here, I'm Dr. Chan. I'm a medical doctor from Singapore. My passion is in helping people to unlock the power of their lifestyle and their dietary habits as medicine to better prevent, control, and combat diabetes, cardiovascular disease, and other lifestyle and diet related chronic diseases through one-to-one coaching, through training workshops, programs, and online courses. Let habits be thy medicine. Eat well and be well.